they will schedule again the patient for the final requirements nga i-require sa center. And that is number one, what we call the DDE or the drug dependency evaluation. Now, the drug dependency evaluation or exam is being made by a licensed physician or a trained physician na capable of handling, assessing, and evaluating the severity sa case sa usa ka pasyente. Alright? And through the DDE, we will be able to determine if ang pasyente deserves to have the what we call the inpatient rehabilitation, or if dili kaayo, if mild lang or very low risk lang kaayo, basin mo recommend lang pod og outpatient service or the community-based na rehabilitation. What's up everyone? My name is Dr. Junes, and today very intriguing kayo nga tuwang istoryano because dagan kayo gapangutana ani mapakaila nako or kaila sa kaila or even mga students during lectures, even on messengers or TikTok na ay mga ga-ask with regards ani, because ang ato ang topic karon is unsa ba ang requirements para makasulod sa usa ka rehab center. But before we go any further, again, another disclaimer, nga tanan natong istoryahan diri is purely for educational and awareness purposes only, o dili ni siya intended nga mo replace sa any other complicated nga mga situations. Especially nga the process of kanang makasulod sa rehab center ang atuang istoryahan. Okay? So, two things nga dapat nato mahibaw-an. The first thing is that naay mga types of admission. Alright? The two types of admission, ang first ana is what we call a criminal case. When we say criminal case, from the name itself, no, naani siya a criminal record. So kung i-connect nato sa atuang balaod, RA 9165, nadakpan siya, na prove nga naa siya na violate nga regulation sa drugs, and then basically nagka-record siya na siya criminal case na dayon. Alright? And ang second nga term is what we call the voluntary. Voluntary refers to kanang bitong wala siya criminal record, but willing ang pasyente nga magpa-rehab because either the parents or the patient itself or himself knows nga naanay problem sa iya. Alright? So, first off, for a criminal case, what happens mainly is magpadala ang court sa usa ka rehab center, for this matter, treatment and rehab center. Magpadala ang court nga naay ipa-undergo og 6-month rehabilitation program. Now, once madawatan na siya sa TRC through the HIMSS or the Health Information Management System, if madawatan na nila, what they will do is that they will schedule the patient for what we call a pre-admission requirements. Basically, these are laboratories, no, para ma-check if kumusta ang kondisyon sa pasyente. And this one would include a drug test, drug test basically para may bawaan kung naabay recent nga exposure or intake ang patient sa mga ginadili nga droga. The common ones are shabu and marijuana. And of course, we have chest x-ray. So, i-check kung naabay kondisyon niyang baga like TB, pneumonia, or naabay siya mga existing lung conditions nga dapat mahibawan. And also, there's a need to check the ECG or kumusta ang iyahang kasing-kasing. Dili gugma ha, but kumusta ang iyang kasing-kasing in terms of function. Naabay makitaan nga kanang ginatawag nato nga inconsistent nga heartbeat or abnormal heartbeats, naabay kakitaan, or naabay mga senyales nga naay defect ang iyang heart. That is very important. And also, there's a need to screen for hepatitis B, kung kumusta ba ang iyang kung nabay problem nga nakitaan sa iyang atay, nabay hepa nga ga-exist sa iya. There's also a need for CBC or a complete blood count. We are trying to check if nabay existing mga infection or naabay kanang problem sa iyang bleeding, like sa iyang mga platelet, or other factors no nga pwede nato mo consider like anemia or any other conditions nga pwede consider. Another important laboratory is what we call the urinalysis or ang pag-check sa ihi, just to check no kung naabay kagaw or naabay nana nga nakitaan. That might also be related to sexual transmitted infections, and that is also the reason why a VDRL or a test to check for syphilis, a sexually transmitted infection, na siya, and isa na siya sa gina consider just to make sure na safe ang patient once mosulod sa rehab center. So those are the laboratories. Again, we have drug test, chest x-rays, the ECG, the Hep B screen test, the CBC, the urinalysis, and of course, the VDRL. Okay? Muna siyang ginatawag na to nga pre-admission requirements. Alright? So, it's either that is kanang cared of budget sa government para i-cover na siya nga requirements, since there are treatment and rehab centers no nga naanay kaugalingon nila nga laboratories and x-rays. If not, pwede po na siya nga care of the significant other or care of like private diagnostics na if maka-afford ang pasyente. Alright? Now, once mahuman na siya, what will happen is that the TRC, through HIMSS, they will schedule again the patient for the final requirements nga i-require sa center. And that is number one, what we call the DDE or the drug dependency evaluation. Now, the drug dependency evaluation or exam is being made by a licensed physician or a trained physician na capable of handling, assessing, and evaluating the severity sa case sa usa ka pasyente. Alright? And through the DDE, we will be able to determine if ang pasyente deserves to have the what we call the inpatient rehabilitation, or if dili kaayo, if mild lang or very low risk lang kaayo, basin mo recommend lang pod og outpatient service or the community-based na rehabilitation. Alright? And included po ana part sa ginatawag na to DDE is the medical evaluation. So based on the pre-requirements, based on the laboratories and x-rays nga gihatag, the licensed physician will have to check as well if ang patient ba is really that fit in terms of joining the inpatient rehabilitation. Because sa inpatient manggod, basin na ay mga higayon nga nakita siyang laboratories nga like let's say infectious siya or incapable siya of making fine or solid decision making, or naabay mga physical disability sa iyaha nga mohinder sa iyang rehabilitation, or naaba siya ay kanang medical condition, let's say for example cancer or lupus or any other conditions nga dili mo qualify sa iyaha nga makasulod sa rehab center. And if that is the case, the licensed physician will recommend to the court nga sa lahi na lang jud siya nga aspect, or iya lang sang ipaayo ang iyang self before siya makasulod sa rehab center. And that is the purpose of that is para maprotektahan ang pasyente, para at least mag-heal siya on his own, and of course protecting the other patients po nga naa na sa sulod sa rehab center. Kay basin matakdan na hinuon sila og tuberculosis or matakdan na po hinuon sila og other infectious conditions nga dapat makontrol ra unta din siya. Okay? So muna siya muna siya basically ang gakahitabo sa usa ka tawo nga naay criminal case. For the other one, for a person who has a voluntary case, medyo similar ra ang requirements no nga gipangayo, but the only difference is that with a criminal case, it was the court who sent us the information no nga naay ipa-rehab, nga i-suggest ipa-rehab. But for the voluntary case, it's the significant other or the patient himself. They would have to go first to a lawyer, and then a lawyer would send a request to the higher court asking magpa-voluntary rehabilitation ni siya na patient. And that is without criminal case. The main reason why that is being made is kanang bawal manggod nga kanang ginatawag na to nga illegal detention. So bawal nga ipasulod diretso ang pasyente sa usa ka rehab center without a court order. Alright? So once maaprubahan sa korte na ipasulod siya for a voluntary case, may it be with drugs or may it be with kanang because of alcoholism or napoy uban no, even if it's not drugs, even with vowsy actually na ginaparehab yapon since it's a behavioral issue. If maaprubahan gani sa court, the same process happens wherein the court or the significant other brings the court order to HIMSS or through the TRC or the Rehab Center, and then the Rehab Center will again schedule that patient for a pre-admission. Alright? And katong sa pre-admission, there po din mosulod tong drug test, tong chest x-ray, the ECG, the screening test for Hep B, the CBC, the urinalysis, and the VDRL. Right? It happens again, and after that, another schedule na po para mo undergo DDE and medical evaluation just to see if even voluntary siya, dili ba siya kanang risky nga makatakod sa other residents or other patients nga naa sa sulod sa rehab, or dapat ba siya manambal sa una for PTB or any other conditions before siya makasulod sa rehab. And if agreed or if makitaan na fit for rehab jud ang usa ka pasyente, the licensed physician will basically just inform the court nga yes, pwede ni siya, and the HIMSS will schedule the right time and the right date nga pwede na ma-admit ang usa ka pasyente. And also, if na may mga minor or other underlying conditions, magpadugang dayog mga laboratories na ang physician once makasulod na siya sa rehab center. Okay? And from there, mo undergo na din ang patient og rehab process, no? A minimum of 6 months based sa iyang performance in hopes nga tiyada og naay matun-an tiyada og naay natun-an and prosperous ang learning sa patient. And by that time nga mo graduate or mogawas na siya back to the community, healthy and ready na siya, and will be able to function normally, no, just like anyone else. So, ayun, muna siya ang requirements, and hopefully naamoy natun-an aning discussion. If you do have questions or clarifications, feel free to comment down below, and do not forget to like and subscribe. And again, always remember, sulay-sulay lang jud, ug gugma pero ayaw lang jud sulay ang Take care everyone.